Let's go to this story now. Health Workers Union Nehawu is peeved off with government. They're demanding that the health department employ community health workers on a permanent basis. This is all happening while the country battles a COVID-19 pandemic in health facilities that are in a poor state of disrepair. To discuss this, I'm joined by Nehawu's president, Mzwandile Makwayiba. Mzwandile, thanks for your time. We appreciate it. So you had a press conference today. You're going to go on strike on Thursday, but you're not being heard regarding your concerns, which you've been talking about for some time now.
Well, it's a number of years. I also learned this today during the interviews that at one stage, health community workers took the government into court, and there was a favor. The judgment was on their favor. I must say that I missed this, but I've asked my legal department to go and find this judgment, and if we do, we're going to do different fight. One will be, should this be found, one will be to take this matter into court and ask the state to comply. And then while we busy struggle to making sure that health community workers are being made permanent and absorbed by the government. Yeah. We're doing this amongst other reasons that the health community workers are important on the primary health care, because we all know that the reason why Cuba is excellent in their health system, it is because it emphasizes the prevention rather than cure. And we have been understanding that the reason for this particular system was exactly to do that. We cannot understand now what makes the government to drag its feet in implementing this, because it is also the manifesto of the ANC that when we were campaigning, these were one of the reasons why we're supporting the current ruling party. And surely we got to take up into street, and we go to take up each and every avenue that is available to us in order to compel the state to comply.
So very quickly, because I'm running out of time, let's talk about your protest action on Thursday. Of course, you are an essential service. How is this going to impact on the running of clinics and hospitals and other services?
Health workers are not necessarily part of essential services. Remember, these are workers who go to different homes and wash those patients that probably be full-blown AIDS, those patients that are caught up by stroke, those who are sick at home. Their responsibilities to go out there during the COVID to test people in the community and so on. They are not necessarily affected, and no one can argue at the present moment that they are essential because they are not employed by anybody.
Okay, so let's talk about what we're finding in the Eastern Cape as eNCA. We're getting reports that there are scores of healthcare workers who are dying because of COVID-19. What's your response to that? What are you doing about what's happening there?
Well, the long-standing battle on the question of PPEs is still the biggest issue, and is a big contributor on the deaths, on the dying of health workers. It is also the deficiency of the state, particularly the Department of Labor, being able to force the Department of to comply on health and safety. And these are one of the issues that we are fighting. We hope that in this meeting that is coming on the 26th, where minister meeting all health MSCs, the part of the discussion is going to be the question of complying on health and safety, because the Department of Health have, as an independent organization, to go to each and every province and go each and every health facility to check whether this has been done. And we told the department long time ago, before the COVID, we told them during the COVID. But the problems that you are seeing in the Department of Health are not necessarily problems because of COVID, are problems that have been there even before the COVID. You remember some Section 27 NGO at some stage marched in the Eastern Cape because of the collapse of that department.
Yeah.
And that matter was never resolved because, for reasons that we don't know, people are very eager to steal, but people are not eager to make sure that services that must reach people are solicited and they are done without any fail.
Okay, thank you so much for your time. We appreciate it. Nehawu's President Mzwandile Makwayiba.